Good morning, everybody. I'm going to be here to show you a couple of early morning stretches that I've developed in doing. I have a little bit of a back issue. I threw my back out last Thursday. I have been researching and YouTubing different stretches and exercise I can do to kind of get myself out of this mess. This is going to be sort of like a mini series, which you will see me at least once every day talking about different stretches that I do, and I'm going to be making some references to different videos that I've watched. I'm going to be putting those links down below in the description so you can see what I'm talking about. I'm not anything but just a person that has thrown their back out, have been in pain before, and has got to discipline herself to get back on track. And so I'm documenting this. We're going to spend some time going through a couple of morning stretches to get your day started. Make sure you have a proper pillow for your legs if you're sleeping on your side, and make sure you have a proper pillow to sleep on for your head. But when you're waking up in the morning and you're stuck in a jam and you don't really want to be in excruciating pain, what I have found to be helpful the last few days are these few stretches that I do to get myself out of a jam and get out of bed. So, say I'm lying on my side right here, and I'm just sleeping like this. You want to figure out how to get one of your legs up slowly. If you have to lift it yourself, go for it. Leave it there for maybe about 15-20 seconds if you can. But be sure to kind of stretch this out slowly. And you'll feel kind of a pull right here. And that's okay, as long as it's not hurting your back. And then slowly, if you have to guide your legs to rotate to your back, this is where we want to go, is to your back right now. You want to slowly rotate to your back with your legs up, with your knees pointing towards the ceiling, and sort of guide your lower back to the center if you can. And then if you still feel like you can't get out of bed and you're in this position, you do not want your legs flat, because for me it would hurt too much. So what I would do is, right now, bring your arms up, bring your legs up slowly, and breathe into it and stretch this part out as far as you can. If you can only go this far, that's fine. But if you can go a little bit further without being in excruciating pain, do it, and just breathe in and out into this stretch slowly, and go as far back as you can. So you want to do this for about maybe 20-30 seconds. Bring it back down. You can do this a few times if you want to, but do not do it fast if you're hurting really bad, okay? Another thing I find very useful is bring one leg up, stretch it as far as you can, and hold it 15, 20, 30 seconds, longer, shorter, whatever you want. Breathe into it. Do your breath. Breathe in, breathe out, and bring it back down. Switch to the other side. Bring it back down after you breathe into it. And if that feels okay, Bring one leg down. Now, every time I do this, part of my spine does this knocking into my spinal cord, which I always think it's going to go back in place, and it doesn't. That's not affecting my pain. That's fine. If anybody else goes through this, let me know, and let me know what you do too. Anyway, you have one leg up, and you do the same thing if you're not hurting. Just stretch it as far as you can. Breathe into it. Breathe out. Slowly bring this leg back down. Now what I do is I bring this leg back up for support, and then I slowly bring this leg down. You can guide it down, or you can put it down yourself, whatever feels comfortable for you. And then you do the same to the other side. Stretch it as far back as you can. Now I'm feeling a little bit of stiffness here, so I'm going to take a little time to breathe in and breathe out. Bring it back a little further. And then slowly come out of that stretch and come out and set that leg down. Now I've seen people do this, and this has been really helpful for me. Some people do it with their arms down like this, or their arms out like this. I find this effective for my arms to be out like this. It feels proper, and it feels balanced. What you want to do is slowly rotate both of your legs, knees up. Rotate it to one side, but not moving this area at all. You want to keep this like this. You don't want to rotate into it. What you want to do is rotate very slowly as far as you can, breathing down. Stretch into it. A good twist to get your spine back in place. This is still in progress for me. So and then you can bring your legs back up, or you can guide it back up with your hand, whatever you feel is best for you. And then you do the same to the other side. Take it real slow if you're in pain. Right now it's getting a little much, so I'm going to take it slow. And I just got myself out of a jam. I'm not in pain anymore. That feels much better already. I don't feel any crackling, but I just got myself out of excruciating pain. Come back up slowly, or guide yourself up with your hand if you want to. And so when I came back up, the pain isn't there like it was before. Another thing you can do in this position on your back, if you are able to and it doesn't hurt you, bring one leg down, one up. You want to go again, rotate this way, down, but have this hand down to do the stretch. Breathe into it. Breathe out. And guide your leg back up to center. Bring this leg up and put this one down. Slowly. And do the same thing to the other side. If you have to guide it, that's fine. Now this doesn't feel right, this doesn't look right, and probably does not look right on camera, but I'm doing the best I can. So you want to just rotate into it slowly. Guide it with your hand here to stretch it. should feel a stretch. No pain. And breathing. Concentrate on your breathing. It's really important. Do not hold your breath. Hold it for about 20-30 seconds, whatever feels comfortable for you. Bring your leg back up. And at this point, if any of these alleviate any pain and you're able to rotate to one of the sides, whatever side you're on, usually I sleep on the right side where the bed is this way. I will rotate this way to my side if it feels comfortable, and then I will push myself up like this and see how I feel, and then get myself up to a sitting position. My legs will come off the bed, and then hopefully I can slowly get up and get out of bed. That has gotten me out of a jam in the last couple days. It has been super helpful. Another thing I want to show you is if you happen to be lying on your stomach, it might be comfortable for some people, it may not be, but I found this to also be helpful for me as well. Say you're lying on your stomach, and you're sleeping like this. Probably won't be able to see this, but if you're lying on your stomach, make sure you have your pillows comfortable to what's recommended. Please do your research, as I still am doing my research. What you want to do is you want to make sure that you're flat, your legs are stretched, and just kind of lie in this pose for maybe a few minutes if you can. Your face can be down, your chin can be down with the pillow, and just kind of lie like this for a while. If you happen to fall asleep like this, that's fine, but I wouldn't recommend being in this position for too long. But this does help with your spinal cord right here. It does keep this straight, and it improves your posture. So that's why I think it's a good idea to do this. So if you can have your arms like this, locked down sort of in front of you, and sort of push yourself up just a little bit. And stretch into it and breathe. And then you can move your arms out like this, down, your forearms in front of you, your elbows down, and slowly lift yourself up. Breathe into it. And you can also, if you're able to, which I'm not able to, do this to stretch your back. I'm not there yet. If you're not there like me, don't worry about it. But do what you can and stretch your back up if you can. Whatever will not hurt you. And just breathe. It's a little much for me, so I'm gonna just kind of slowly come down. And then another way to get out of bed is if you're just sort of lying like this and you don't do these and it hurts too much, don't worry about it. If you can get yourself up, that's the important thing. Getting out of this position, you do not want to do this fast. You will hurt yourself. Lift yourself up with your body like this, your knees like this. Bring them in. What I like to do to also stretch is I'll do like a stretch like this. Stretch long and far. Breathe. Slowly bring yourself up. Hopefully this position, and then take one leg off to the side of the bed, and hopefully you'll be able to get up fluently without any pain. I hope this helps you. I will be doing a few more stretches and exercises throughout this recovery with my back. Already after doing this, I already am starting to feel better than I did when I started this video. So I'm sorry it's long, I'm sorry it's lengthy, but this is my first time doing this. Hopefully the rest of those videos will be shorter. I hope you find them useful. Please check out those links down below of other people talking about their experience, professionals, doctors, yoga practitioners, yoga people who are really like more flexible, have better suggestions than I do, and also do some research on the Mackenzie. I will look for articles down below so that myself and you guys can be better educated on how you can take care of your back and your body. If you can't afford to go see a doctor or chiropractor like me, you're going to want to treat yourself, and this is why it is so important to get online, do the best research you can, try a few different things that work for you, and if something doesn't work for you or it's too painful to do it, don't do it anymore, because everybody's body is different. Everybody goes through different things, pain, healing. If you can wean yourself off of any medication such as Advil, Tylenol, all that stuff, yes, it does temporarily take away the pain in your back, but it does not take care of the problem permanently. What you want to do is take care of this problem permanently so that you can better yourself. These stretches I've done will hopefully help you feel some relief of that pain or excruciating pain or stiffness. I'm learning as I go along. This is my journey to recovering a stupid injury. I will see you tomorrow. Alright, take care. And as Zen Archer would say, be well.